Good morning, everyone. Welcome to another repeat of the forum. We got such good feedback last week that you thought this was useful information and enjoyed receiving it. We decided to repeat it again this week. So Good Friday to each and every one of you. This is Friday the 10th of April. Welcome to our forum. To get us started, I'm going to turn it over to Don Infante with a few words. Don?
Good morning, everyone, and welcome to our second in a week Regency Oaks Forum. You all gave such positive feedback on this one that Brant decided to have another, so here we are. As the president of the Regency Oaks Resident Organization, it's my honor to represent you here today. I want to start off by wishing you all a happy Easter. We're going to have a great meal for Easter, to which we owe Ricky and Johnny and all the great folks who were going to prepare that, so I know you're looking forward to that. But I want to thank each one of you for what you're doing to be a part of the team effort that we are here. We're going to whip this thing, but it's going to take us as a team working together as we are. So God bless each of you, and with that I'll turn it over to Brent.
Okay, we're over at the board. Let's take a look at the map of the United States and track what's happening with the virus. You can see Pinellas County, that's the first place to start, continues to look good. There's less blue every time we look at the map. One of the things that they're cautioning everybody across the country with is not giving up too soon on the isolation and self-quarantine measures, because there is a concern that if we become less diligent, that this can spring right back. There are three pretty good examples of that. Look at New Orleans. If you remember a week ago, the city of New Orleans had pretty much cleared up all of their COVID cases. Look how it has just popped back over just the last 4 or 5 days. The same is true up in Chicago. Look at what's happening on the lakefront there. That's the new epicenter for the United States. And the other great example is San Francisco. Again, earlier this week we had looked at San Francisco. It had almost completely cleared up. They've had a second wave of the virus, and all the health experts are saying it's because they got overconfident. They stopped practicing good social isolation and distancing, and that is one of the fears we have to be aware of. We need to continue for the next couple of weeks to make sure we're practicing the safe practices of staying at home, maintaining social distancing, wearing masks. If you're not feeling well, isolating at home. That's what's going to get us through this and over the top. All right, let's take a look at the local numbers and see where we stand. In the state, we have 16,826 cases. That's up about 100, and our death total is now at 371. Here in Pinellas County, we had an exceptional good 2 days. We went up about 25 cases over the last 48 hours. We're now sitting at 422 cases in Pinellas County, and our death rate only increased by 1, so we've had 10 deaths. And in Pasco County, our numbers continue to look really good with 139 cases and 2 fatalities. In the United States, it is unfortunately, as a broader perspective, continuing to grow at a pretty rapid rate. We went up about 14,000 cases since Wednesday. We're now sitting at 466,000 infected and 16,700 deaths. So we will continue to watch these numbers and look for trends. A couple of things that I thought might be beneficial to know. Pinellas County, a little over 1 million people here in Pinellas County. There to date have only been 79 hospitalizations because of the COVID virus. That's a pretty low number. Of those 79 hospitalizations, The vast majority of them have returned home, have improved, because our fatality count is low. It's only 10. You might also be interested in knowing that we're tracking the virus by our specific zip code, and to date, there are only 10 cases in the 33759 zip code, which is where Regency Oaks is. So good numbers, but now is not the time to give up our diligence. We need to continue to practice safe distancing. Leslie, could you give us the community numbers?
Of course. So here at Regency Oaks, we have 0 residents and 0 staff currently under quarantine, and there are no residents and no staff with any flu symptoms or testing in progress. And again, we have no residents and no staff confirmed with any COVID-19 cases. Something that we're doing to observe all the residents is throughout the week, our wellness nurse, Diana, and our temporary wellness aide, Betty Booz, will be going with a dining team throughout the buildings during meal deliveries to observe residents to make sure they're doing well and they're healthy and not experiencing any symptoms. So take a look and you'll see Diana or Betty throughout the week in one of your buildings.
So 2 other things that I wanted to address this morning, and the first is the closing of the side doors. I know that's an unpopular decision, but I wanted you to know it really has had a positive effect. We've been tracking the numbers. We're beginning to see a lot less discrepancy in the number of people who are leaving the community and not checking in. The front desk are reporting that the temperature logs are up significantly, and so it has had its intended effect. And just a reminder, I completely understand how inconvenient that is, but it is something that you're able to do to help keep yourself and your neighbors safer. And so I'm truly appreciative of the added effort and apologize for the inconvenience. But we are in this together. That's what Don mentioned at the start of the meeting, and you have a role to play, and we're all thankful for your cooperation. The other thing I just wanted to touch on briefly, I was thinking about the potential for this virus to reoccur and to have a second wave. And it occurred to me that one of the things that residents of Regency Oaks who are leaving the campus might have in common with all those who are infected or carriers or who are showing symptoms of illness is they all shop at the same grocery store. Going to a grocery store is not a safe practice. You should avoid doing it at all costs. If you absolutely insist upon going, you need to make sure you're wearing a mask, that you have hand sanitizer with you, that you are careful as you can possibly be to maintain a safe distance from others. You have probably seen on the news that there are many cases where public workers have developed the virus, or that food source and distribution centers have developed the virus. And we know that if you're out in the community at large and you're showing symptoms, you're going to Publix to get your food and to get your supplies. It's just not a great place to see. One of the residents mentioned to me the other day that he was going a little stir crazy, and so just to get out of the house rather than going for a walk, every day he was going and walking through Publix. Not a safe practice. Please let me encourage each and every one of you, that is not a safe practice, and we have alternatives available to you if you need supplies, food, or groceries from Publix. All right, and at this point, I'm going to turn it over to the directors for their reports and updates.
I'm Sandra Navato, Human Resources Director. We continue to hire. We had 2 orientations this week, hiring a total of 7 new associates. Additionally, we are working on recognizing our staff. We have designated every Friday in the month of April Jeans Day, as well as pulling the fun card out and delivering goodies for the staff during the week as well.
Good morning, I'm Rance Macy, I'm the administrator over at the health center. So with this crisis going on, everything's very fluid as far as our regulations that we get from ACA and the CDC. And we've made some changes this week based on their recommendations along with the Department of Health. All new admissions coming to the health center now, we have to put on isolation regardless if they're COVID positive or not. I want to stress we are not admitting any positive COVID people, but we need to treat everybody like they may have it because there's been so many false negative tests out there. So we've converted one of the wings in the health center into an isolation unit. The staff providing direct care on that unit will only be treating those patients on the unit. That means the staff back there will be wearing gowns, they'll be wearing face shields, and they'll be wearing the masks like everyone else will be. After 14 days of being on isolation, the residents that are back there will be taken off the unit as long as they're asymptomatic and will be reintroduced with the rest of the general population. So it's not something we want to do, but something we have to do just to keep everybody safe. Thank you.
Friends, this is Jesse Rosalie, your housekeeping director. Just some information updates about what we're doing around. First floor and all elevator areas are being disinfected at least twice a day by one of our team members. We also have our laundries, refuse rooms that are being disinfected daily as well. All recreational areas such as libraries, activity rooms, etc. They're also being disinfected every day. Stairwells, we're trying to also stay active with those areas, doing those at least once a week. As far as what we utilize in housekeeping to disinfect our areas, we're currently using a Oasis 146 multi-quad sanitizer. So it usually disinfects the area between 10 to 20 seconds as soon as you dispose the area of this chemical. And after that, we can just simply wipe down and we're done. So if you have any questions, let me know.
I'm Ricky Bacher, food and beverage. Johnny Hubbs, executive chef. Just a couple updates for you. When the wine cart goes around, it'll be going around on Sunday for Easter. We will have wine, beer, and soda on it available. You'll start seeing sliced bread substituted for rolls. That was a request, so we'll be going back and forth on that. And then for Easter, happy Easter, we're gonna have your soup, lobster salad for your lunch, shrimp cocktail, beef tenderloin, or ham, sides, and a special dessert for Easter. Have a great day. Thank you.
My name is Darwin Perez with the maintenance department. An update on the work orders. We are not doing any work orders except for HVAC, plumbing, or electrical. You still can put the work orders in. As soon as we get back to normal, we will start working on those. We also are continue doing some tasks throughout the community, like continue pressure washing the carports and painting the columns on the breezeway, and all the small projects we're working on. Thank you.
Good morning, Regency Oaks, and Good Friday. I just wanted to emphasize again the clarification of if you needed to get to Publix, you can schedule a Walmart or a Publix grocery pickup that transportation can pick up for you and bring it to the community so you're not out in the vulnerable elements. If you could set that up through transportation or Tuck, and like Brent said, please, if you do need to go to the store, try to get as many items as you need to get past the COVID-19 as possible. We're still doing our meal delivery, so we are truly discouraging any activities of going to public stores, Walgreens, anything that can be contaminated in any manner. I hope that you're enjoying all of the activities that Ginger and myself are trying to put on to be as creative as possible with the social distancing and still enjoying yourself at Regency Oaks. Thank you and have a wonderful weekend.
Okay, thank you, Tiffany. We appreciate the update. And now we're going to open it up for our questions and answers.
I've got a lot of questions coming from the residents on when are the updates and what can we expect to see on channel 732 West. So if you could clarify that for us, please.
Sure, Don. Our COVID updates are every Monday, Wednesday, and Friday. You can catch a new edition at 12:30, right before the midday movie, immediately after the midday movie, and then after dinner, there are hourly updates and you can catch it at any time.
Sherry, automatic payments this month, yes or no? I'm getting a lot of questions from people on how to handle this month's statement.
Yes, our statements were delivered to your in-house mailbox at the end of last month. The automatic payments did occur as were scheduled on the 1st and the 5th of this month. Payments for writing out checks, please drop them off at the front desk as usual. If you have any questions, please don't hesitate to reach out to myself at extension 337 or Bethany at extension 506. Thank you.
Leslie, good morning. I've gotten several questions. I understand we have 7 independent living residents who are in the hospital. Can you explain how they're going to be handled? And we're going to make sure that everything is safe, please.
For those residents that are currently in the hospital, it is not due to COVID-19. Whenever they do return back to independent living, just like we are doing currently for our new residents that are moving in, we're making sure that they are staying in their apartments for 14 days for quarantine, and they are getting wellness visits where they're temperature checked, as well as asking them about any symptoms that are occurring to make sure that they are still COVID-19 negative.
Another question for Leslie. I've had several residents ask me what they should do if they become sick. What exactly should our residents do if that's the case?
Great question. So if you are feeling sick, let us know. Call the front desk or myself or the wellness nurse, and we'll come and speak with you and see if you are experiencing a fever over 100.4 and other symptoms like sore throat, cough, shortness of breath, fatigue, vomiting, and we'll make sure that we are tracking your symptoms. We will help you contact your primary care physician to see if they will write you an order for COVID-19, and we'll make sure that you get tested if you are ordered one of the tests, and we will go forward from there once we receive results.
Grant, I'm getting a lot of questions from our residents as to when we think we're going to be going back to normal, and what will the new normal look like? We're going to continue with the same sort of life, or what do we see changing?
So here in the state of Florida, the data that I am looking at would suggest that somewhere around the 21st to the 25th of this month, we will peak, and then at that point, the plateau will be on the downside, and I would think 2, maybe 3 weeks before we get back to normal. When we think about the new normal and what that's going to look like, just as we were cautious and used a layering approach in putting restrictions in place, that will be our same philosophy as we come out of isolation. It will be a layered approach. We will not just open everything all at once. It will be a very strategic, gradual reintroduction of residents into the normal daily activities of Regency Oaks, including transportation and housekeeping and maintenance and dining services. It's going to be a very gradual approach. But I think this pretty clearly is going to take us into June before we get back to a full normalcy.
Jesse, we have such diligent, clean people, and some are asking, are they able to borrow such things as mops, brooms, and stuff they don't have to clean up their own place? Can you in fact assist us residents on that point?
Indeed, we actually encourage that. If you do need a vacuum, we suggest to call me ahead of time, and we will provide you a loaner, we will disinfect it, and we will ensure you receive it the day of service. But it's highly encouraged to contact me should you need anything as far as a mop or a vacuum to clean your floors. Thank you.
Darwin, first of all, welcome. We hope that you're settling in well. I've had several residents say that if they have trouble with their TV, given the current situation. I know that's not a thing such as water or heat and stuff, but what do they do if they have TV problems?
If you have any issues with your television to get that channel, please call to the front desk. We will make sure you get it, because we want to keep all the residents informed of all the situations that's going on.
Okay, that concludes our meeting for today. Thank you very much for joining us. From myself and the entire staff, we wish you a very blessed Easter, and stay safe. We'll see you next week.